Well, good afternoon. It's all hands on deck right now when it comes to getting our kids back to school safely this September. We have spared absolutely no expense. We have taken every step possible, and I am proud that Ontario has the safest, most cautious plan in the entire country right now. And that means dedicating nearly $900 million. That's $900 million to make sure we get this right. Because, my friends, getting 2 million students, getting hundreds of thousands of support staff back to school this September, it's not the easy thing to do, but it's the right thing to do. Because our students, they learn better in the structure of a classroom. They need the social interaction. They need the support of their teachers and peers. And we will always keep their health and safety first. But we can't let our students fall behind. We can't sacrifice the quality of our children's education. That's why I want our kids back in the classroom where they belong. But let me be very clear. I won't hesitate, not for a second, to take further action if we have to. I won't hesitate to do whatever it takes, because the safety of our children will always be our #1 priority. That's why we're hiring 500 new public health nurses for our schools. That's why we're hiring 1,300 new cleaners. It's why we're investing $30 million to hire more teachers and support staff. It's why we're investing $25 million more for cleaning supplies and sanitation. And it's why we invested $50 million to update ventilation systems. We have $18 million to support online learning by hiring dedicated principals, specifically to run online learning. We have $60 million for masks for all staff and students who are unable to afford a mask. $73 million to support aggressive testing in Ontario's secondary schools. $40 million in cleaning for school buses twice a day. $10 million for health and safety training for teachers and staff. $10 million in funding to support special education students, and $10 million in new mental health support for students. My friends, we have an extremely robust plan, the safest and most cautious plan in the entire country. And today, the federal government has announced that Ontario will be receiving an immediate payment of $381 million to support schools reopening. This is good news, because as I told the Prime Minister during our meeting last Friday, when it comes to keeping our kids safe, we're all in this together. School boards, education unions, school trustees, we all have a role to play. We all have a responsibility when it comes to keeping our kids safe in schools. Our medical experts and education officials have developed the safest, most cautious school reopening plan in the entire country. And this funding will only enhance our plan. We will target that funding where the extra supports will be most effective: for ventilation, shoring up PPE supplies, additional remote learning supports, enhancing safety measures on school buses, and hiring more teachers and hiring 125 more public health nurses, for a total of 625 public health nurses in our schools. And we need to be ready, because we know COVID-19 is still in our community. If the last months has taught us anything, it's that this virus can move quickly. So we need to be prepared to move quickly too. That's why today we're releasing our COVID-19 management plans for schools. We have robust plans for schools and school boards, so that when a case or an outbreak occurs, everyone knows what to do, so we can quickly find, isolate, and contain the virus. We are providing public health units with guidance on how to assist schools in the event of a COVID-19 outbreak. But we're also providing guidance documents to parents, because as parents, you deserve to see the same information I see. You deserve to know what I know, and to know that when schools reopen, we will be prepared. These guidance documents were developed in consultation with the Chief Medical Officer of Health and other health experts. Our top medical advisors have reviewed, provided input, and put their stamp of approval on all the guidelines. And this important work It will continue all year. We can't let up. We won't let up. That's why today I'm also announcing that Dr. Dirk Huyer, who has spearheaded the province's testing strategy on health command table, will lead Ontario's efforts on outbreak management in schools, childcare, agriculture, and healthcare, including long-term care. We're not taking any chances. Our kids belong in school. They belong in the classroom with the guidance of their dedicated teachers and the benefit of being around kids their own age. And we are prepared to do whatever it takes to protect them. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Lecce.
Well, good afternoon. Almost a month ago, the Premier and I made a commitment to parents that we would provide final clarity on how schools will be able to reopen safely. And we know how essential our response to handling COVID-19 within our schools and communities is to opening those doors. It's why we've invested, as the Premier noted, over $900 million to support a safe return to schools. Our plan leads the nation in science and in dollars. Today's investment by the federal government complements the already landmark investments made by our government in support of our safe reopening schools in this province. We know that your preparations to get your kids ready for school this September come with a new set of challenges. We know that you have questions on how we work collaboratively to stop the spread of COVID-19 within our schools. We're here to answer those questions today. We are joined by some of the best medical leaders in the country. Dr. David Williams, Ontario's Chief Medical Officer of Health, and as noted, Dr. Dirk Huyer. Dr. Huyer has been deputized by Dr. Williams to be the coordinator for provincial outbreak response and will be instrumental in ensuring our schools can reopen safely. Parents, here's what you need to know. First, our over 20 pages of guidance to school boards will ensure that our schools are equipped to appropriately manage, communicate, and handle any potential COVID-19 outbreak. We will do this by ensuring if someone in a school, whether it be a student or a staff, tests positive for COVID-19, the school community is properly notified. Immediate and rigorous contact tracing kicks in. In some cases, the class cohorts will be tested, sent home, or closed until the outbreak is declared over as approved by the Chief Medical Officer and the local health officer. Second, the ministry has created a network of school board contacts and ministry staff to ensure a constant yet nimble flow of messaging and information. You will know very quickly if your child has come into contact with someone who is tested positive for COVID-19. The Premier and I have been clear throughout this entire outbreak. We want you to know what we know. It's why our playbook, if you will be available on the ontario.ca website momentarily for all parents and all educators. Now, parents, we know you have a tough choice to make, but know that if your child returns to school, they will be safe. As we've always said, we will continue to respect the choice and authority of parents. The choice of whether to enroll their children for in-school instruction, the choice of determining when and if they feel comfortable with their child re-entering schools during the year, and the expectation and delivery of live, online, teacher-led, synchronous, Zoom-style learning for their child when they are not in school. We know that the last few months have not been easy for anyone, but I want to take a moment to acknowledge the impact this has had on children across our province. We've heard loud and clear from medical and pediatric experts that COVID-19 has profound mental health impacts on many of Ontario children. Now more than ever, reopening schools is crucial to the social and emotional development of Ontario students, but it's also crucial to allowing parents to return to work and supporting the workforce across our province. We cannot and will not allow students to return to school without the necessary support and resources to enable them to be confident and feel safe right from the start. It's why we are the only province in this country to be hiring 500 public health nurses to assist in our schools. It's why we are embarking on a robust surveillance testing strategy of our asymptomatic high school students. We're the only province to do that. And we're providing money for masks and personal protective equipment for staff and cloth masks for every student in this province. Critical health and safety training for all educators, including occasional teachers, is being provided. And we're increasing investment for special education and asking boards to ensure students with exceptionalities are in class for the entire week. Folks, I want to be clear. We are being cautious. We're taking extra health and safety measures. We are putting in the necessary dollars, and we're supporting you, the parent of this province. Because as the Premier and I have said all along, we will not put your child or our staff at risk. Folks, we have pulled out all the stops for the 2 million students in our province. Our students deserve nothing less. And I just want to end by saying thank you to our parents, to our educators, and to our incredible students. You have truly inspired your province, and we are all excited and grateful for your return this September. Thank you.
We'll go to the phone line for questions. Just a reminder that it's one question and one follow-up, please.
Your first question comes from Caroline Alfonso with the Globe and Mail. Please go ahead.
Hi, Caroline.
Hi, Premier. Hi. My understanding is that you're spending $70 million for teachers from the first half of that funding that you're receiving from the federal government.
Yes.
Why not the bulk of it when one of the key things that we're hearing from parents is that they're demanding smaller class sizes?
Well, we're putting $30 million into that as well. Plus, we have $500 million of reserves, plus $70 million. So we're putting ample amount of money into the teachers, I should say. But on top of that, there's a lot of other areas that are just as important. Making sure that they have enough PPE. They have to make sure that the school buses are safe. But there's a whole list of it, and I'll pass it over to the Minister of Education. Thank you.
Thank you for the question. I think it may be helpful for parents to know where we are putting that roughly $381 million that the federal government has provided Ontario. But to answer the question, just for context, of the $381 that will be provided to school boards for September, $70 million is directly provisioned to hire more educators as per the request of many school boards to have more funding available. We've also enabled $100 million of that $381 million to be used for other school board priorities to respond to the challenge, meaning if school boards have identified, for example, that more educators or more EAs for special education students or more custodians, more cleaning staff are required, we've given them a maximum latitude to use the first $100 million for that. So, you know, to be fair, school board could use all of it for teachers, plus the $70 million specifically dedicated to hire more of them. And that is pretty significant to build on the fact that we have unlocked, and to be fair, virtually every board has utilized and tapped into the reserves to do exactly that, to do more teacher hiring, which we are initiating. Temporary, one time to respond to an extraordinary once-in-a-century pandemic. But yes, we do believe a temporal one-time investment is prudent. That's why we've done it. But just for context of where we're putting the rest of the money. In addition to the $100 million as that funding for school boards to use to respond to the emergency, $30 million more for PPE, as the Premier mentioned, another $70 million for teachers. We're also providing $50 million to respond to the second wave and or the flu pandemic, having an immediate ability of the province to respond to school boards' needs with monies and resources when that challenge arises. And one of the lessons learned when I spoke to the Minister of Education in New South Wales, Australia, is you need to be ready for the flu season. So having that funding set aside will be very prudent for us to respond. And finally, as the Premier noted, another $70 million, partly, overwhelmingly, to help reinstate the driver retention program, which really helps to encourage and retain our school bus drivers, which, as you know, has been a challenge for governments for over a decade in Ontario, and to be fair, across the country. And another $25 million on top of that for more cleaning and more latitude for our school boards and our operators to hire staff if required to clean those buses. So this is more funding on top of Ontario's already leading investment in the country, and we think it's going to make a difference.
Follow-up?
Minister, my second question has to do with the guidance that was put out today on outbreaks in schools. It says that children who are showing symptoms of COVID will be sent home. But I understand there's no mandatory tests required before they return to school. So, you know, in some cases, symptoms could lessen before reappearing. So why are you not asking or mandating a test before children return back to the classroom?
I'm going to turn the question over to Dr. Williams and or Dr. Huyer to answer.
Yes, well, thank you for the question. And we understand when we're doing, especially the fall, when children get ill, there's many reasons they get ill. And our first thing is to determine, are they ill from COVID or not? The mild symptoms of COVID are like a lot of others, including, as the Minister already mentioned, influenza and other respiratory viruses. So the first aspect, if a child is feeling unwell, one, if the parent knew that, they shouldn't go to the school in the first place that day until they ascertain what is wrong with their child. Second, if it is ill, then we send them home with proper notification of the parent, so they can then undertake an assessment, whether that's through their healthcare provider or their medical history of their child. They know what the situation is. They would be able to take the temperature and do other things that would be appropriate for a parent to do at that time. If they need to get tested, and if their doctor or other assessment center feels they need to get tested, they will get tested. It may be an ear infection. They may have a history of that. So we want to be sensitive to the fact that children don't always get sick from COVID in that. The other factor is we want to be cognizant of what's going on in the community. If there's no COVID circulating in the community, that's not always your first go-to diagnosis. If you have widespread influenza, you need to look at that, and the physicians and primary care doctors and pediatricians would be aware of that and would have that discussion with the family and members in that, and would make recommendations back whether they felt a COVID test was necessary or not. Again, we want to make that decision-making kept with the parents. If it is really in the midst of COVID, then our public health nurse, in consultation with the local medical officer of health, may decide to have some discussion and to request perhaps they would consider getting a COVID test. Each case is different. Each case needs to be approached separately, respecting privacy, respecting where the situation is with the child and the parent at that time. So it's one that we can entertain, but we'll do it in the proper method of clinical assessment and diagnosis to give us the best advice in the right time and to give the direction to the parent with what to do with the child accordingly.
Next question.
Your next question comes from Colin DeMello with CTV. Please go ahead.
Hi, Colin.
Hi there. Premier, I'm just curious about this, the money from the federal government. You have always said, and you said it again today, that Ontario has the best back-to-school plan in the entire country. Mm-hmm. I'm curious then, Premier, why did your government even accept the $762 million from the federal government? Why does Ontario even need that money if Ontario indeed has the best plan in the country?
Why wouldn't we? You know, when I met the Prime Minister on Friday, he asked me, you know, about the going back to school plan, and I explained it to him, and I said, we're all in this together. We need all levels of support. We need the federal government, the provincial government, and the school board, school trustees, and the teachers' unions all on board. And this just enhances the plan that we have, and I stand by it. We have the safest and the most cautious plan in the entire country. And thank goodness that for Dr. Williams, thank goodness for Dr. Huyer. You know, they put their stamp of approval on it along with other people on our health table. But now we have Dr. Huyer there for Outbreak right across the province. And you can't ask for anyone better than Dr. Williams or Dr. Huyer. And I'll pass it over to Dr. Huyer. Thank you.
Well, thanks, Premier, and hello to everybody. I just want to thank the Premier and Dr. Williams and others in the provincial government for providing me another opportunity to play a role in helping to deal with this horrible pandemic that's led to many challenges over the recent past. One of the roles that I have is to help provincially take a look and keep a broader view across all the different sectors, working together with many key leaders from all of the different ministries, really to understand what's going on provincially from an outbreak point of view. I have the honor to work closely with Dr. Williams, who will be obviously leading the expertise in the public health world, and I will be more of a coordinator and a facilitator and really having, as I say, a bird's eye view of everything. On how we can manage and effectively do this. Clearly, education will be an area where there is a risk of outbreaks, but all of the efforts in reading through the guidelines and the guidance really focus on number one, first and foremost, which is prevention. Everything would be better if nobody gets sick. And so if we can take those steps for prevention, and you've all heard it before, but you'll hear it again, and I'll keep saying it. Proper social distancing or physical distancing, proper hand washing, proper awareness, caution and care, and not going to school or other places when you have symptoms and figuring out what those symptoms may be with the assistance of medical health providers are fundamental. And also the school boards have taken some great steps following the guidance, as well as many others, of keeping track of cohorts, who's with who, and so that will allow, if in fact, which we hope we don't have to deal with, there's an outbreak or an infection, that there can be tracking quickly done by those experts in the public health world. I remind people of the COVID-19 app, It's something that allows, again, the public health response and is something that is easily downloadable and allows people to have the opportunity, as the experts get involved, to really work towards responding to any positive cases that may be present. So thank you very much, Premier, and thank you to everybody for the hard work that we're doing together.
Follow-up?
Thank you. And Premier, if I could just kind of follow up on what Dr. Huyer had said about the contact tracing app. Are we allowing high school students to keep their cell phones with them, or will their cell phones be banned from the classroom? And just as well, what is the expectation of teachers when it comes to contact tracing? Of course, public health nurses are going to be supporting these schools, but what level of contact tracing management do teachers have to do in the classroom, and what level of detail are we looking for when it comes to student interaction from teachers themselves?
So the first part, I'm going to hand over to the minister, and then the minister can hand it over to Dr. Williams.
Yes, on cell phones, just so we're clear, the province, under the Premier's leadership, has restricted cell phones. We want to remove the distraction. The guidance we announced last year does not change. They're not to be on your desk, but they can be on your person. They can be in your backpack or a purse. That's acceptable. We just simply want to remove them from distraction. As you know, the app does not require active use. It could be just sort of put on quietly on mute in your backpack, and it still works. And that's what we're encouraging students to use, that common sense application. They're going to have their phones with them anyway, as you know, Colin. We just don't want them to be distracting from learning in the curriculum before them. On the second question, I think I'll turn it over to Dr. Huyer.
That's right, thank you. On the question of the role of the teacher in this, one of the reasons why we're bringing in our public health nurses is that they are there, because in these outbreaks, one wants to know, who do we call, who do we talk to, who do we get advice from and direction around issues that relate to public health. And we want them to establish that relationship with the teachers, with the administration, and with the parents, so they get to know who that person is. That means the teacher, if they have some concerns or questions, they should feel free to contact that public health nurse to ask those questions. They may have some knowledge and extra advice to give on that. The nurse would be responsible for identifying if there is a case, confirming that, and dealing with an outbreak. Because in the classroom or the cohort, the teacher is part of that classroom and cohort if there's an outbreak within that cohort identified or cases in there. So the teacher is very much a critical part, especially noticing some illness or behavior among students that they may want to inquire about on the public health nurse. And they want to be kept informed and advised as well, because they're just as interested in the safety of the children as the public health nurse is, as the whole system is. So it's all a team effort, and we play that throughout. So we want everybody doing their part, and the parents are most interested too, not only their child's health, but they want to make sure that the child's health and their friends, their classmates, are healthy as well. So it's everybody together, but coordinated through case management and contact tracing through our public health nurse, who of course is connected back to the health unit, to their case contact management team, which is connected back to their MOHs and their AMOHs in their local health unit. So it is a full team approach to deal with any issues if and when they arise.
Next question.
Your next question comes from Lauren Tully with CBC News. Please go ahead.
Hi, Lauren.
Hi there. With all this money coming in for prepping for the school year and all the prep you've done so far, can you just talk a bit about the focus for vulnerable schools where we know there have already been the most COVID-19 cases? Is this still something that you want to focus on and encourage the boards to focus on now that there is this influx of cash as well?
Absolutely. We've always focused on, let's say, the hot areas throughout the province, no matter if it's the agriculture sector or long-term care, and as well as schools. But the person that's going to be really focused on that is Dr. Huyer. So I'll pass it over to Dr. Huyer. Thank you.
We did the multi-dance there. For those of you who can't see, all four of us moved around. So thank you, Premier, for that question. I think that really looking at outbreak response is the goal and the expertise of the public health units. But one of the roles that I will be working with the other leaders in the other sectors is to have an understanding of what is the information, what is the data, what is the potential presence of, as the Premier referred to, as a hotspot or an area where there's infection. And Dr. Williams talked about when there isn't a lot of infection within an area, that would change the potential approach to the interpretation of symptoms or a test result. So it's really having that broader view across the province as to where there may be areas of increased risk and increased concern, and then adding additional perspective and support to those particular areas so that we do ensure the prevention efforts are strong, but also that we respond promptly, specifically in those particular areas with knowledgeable people, but also informed by the data that will be available on a regular basis, and hopefully in a coordinated, well, not hopefully, in a coordinated way that we can really look across the province and see where are the areas that we need to put that additional focus.
Follow up.
This is a question for Premier Ford from one of my colleagues at the National. September rent is due in just a few days, and in Toronto alone, it's estimated that thousands of renters have already received eviction notices during the pandemic. So, is there anything else your government is going to do now to protect these people who still can't pay their rent amid COVID-19?
Well, we've always said from the beginning, we'd like a discussion between the tenant and the landlord and try to work things out. But we've enhanced protections for the tenants. For instance, if someone's just being kicked out of their apartment, and the people are saying, well, my brother or my son's going in there, and they don't go in there, they're going to be compensated a full year of rent. So these are some of the enhancements that we're going to put forward. I'll always protect the tenants. That's my #1 priority. But I also have to be fair to especially the small landlords that we've heard a lot of stories about, the mom and pop landlords per se that might be renting their basement out and they're relying on that money to pay their mortgage. So it's absolutely critical that we try to work things out and communicate with each other. And if you have a job, then pay your rent. That's all I'm asking.
Last question.
Your final question comes from Natasha McDonald with Radio Canada. Please go ahead.
Hi, Natasha.
For the Premier. Are there any strings attached to this federal funding? So can you really spend the money as you wish, or do you need to respect certain guidelines?
Well, the #1 area that we always respect, you have to respect the taxpayers. We're accountable. All 3 levels of government are accountable to the taxpayers. In saying that, I know a few of the premiers weren't happy that someone was stepping on their toes. Federal jurisdiction is an education, and so on and so forth. And I just said very simply to the premiers yesterday, guys, we understand that. The Prime Minister, when he spoke to me on Friday, the first thing that came out of his mouth was, Doug, I understand this isn't my jurisdiction, but I just want to help. And we're grateful for that, and I want to thank the Prime Minister for that. So again, there's no ties to it. He's given us the flexibility, so there's flexibility, plus he's just trying to help. So we appreciate the money, we're grateful. We're going to use it very cautiously.
Follow up.
My follow-up for Minister Lecce.
Yeah.
So many schools, including French schools, have still not told parents what date exactly they should send their kids back to school. So has your government given a deadline as to when that information should be released? And can you answer in French, please?
I will not offend you by attempting to try en français, but that's part of my professional development plan. But for now, what I could just simply say is for all school boards in the province, the obligation is for them to communicate very clearly the start date. If they're staggering the school year, as you know, the government, the Premier has indicated we will be flexible and reasonable. So when public health says, look, we could use a few extra days, and the school board agrees, we gave them that. So with respect to French boards, many of whom open early, I guess, which is the basis of your question, yes, they're expected to communicate immediately on that start date. The overwhelming majority of students in Ontario and the overwhelming majority of school boards have landed their plans well north of 75 to 80%, representing the overwhelming majority of the populace. But for those outstanding parents and those kids, they deserve to know, and we'll work with school boards collaboratively to make sure that information flows as soon as humanly possible.
Thank you, everyone.
Thank you.
Great. Thank you, everyone.